Hello, and welcome to your mini session on data collection tools. As community health workers, there is a variety of tools and assessments that you can utilize to be able to better understand the needs of your client. They can be the social determinants of health questionnaires. They could be the patient health questionnaire depression scale, or also known as the PHQ-9. They can be the Behavioral Risk Factor Surveillance System, the BRFSS, which is a national health-related telephone survey, which has questions on health-related risk behaviors and chronic health questions, use of preventative services. Both of the last two are also available in Spanish. We have a variety that our evaluations team and research team utilize to collect the data, such as our COVID vaccine hesitancy surveys, which are product surveys that we administered through our drive-thrus and pop-up vaccine events, and of course other health-related social needs screening tools that maybe your organization has on hand in order for you to better determine and zero in on what your needs of your clients are. For the sake of this project, we are actually going to be looking at some vaccine event survey tools that you are required as a community health worker to complete during events. This is specific to this grant, which is our statewide grant, and to be utilized on site with a community member who has either is receiving or has just received a vaccination during the event. Tool 3 is our tool that we call or is best known as, for our first and second doses for those who are receiving those vaccines at that event. It's pretty much considered for anything that's a primary series, so in the rare case that it's somebody who's receiving a third dose, which is considered part of their primary series, you would be using this first tool, this tool 3. And then if it's anybody who is receiving their booster dose, whether it's their first booster or their second booster, both are eligible, then you would utilize the one that is known as tool 4. And that is specific just to boosters. And as mentioned before, the second booster has been approved for Pfizer in individuals who are age 50 and older and individuals who are considered severely immunocompromised. And those individuals are also those ones who have received the third dose of their primary series and who are 4 months out from their booster dose. So let's walk through these a little bit. These again are used on site with the community member who has received the vaccination. Tool 3 is for those in the primary series, and tool 4 is those who are receiving their booster dose. And you must complete, or at least offer to complete, a survey for every vaccine that is provided, whether it's a child, for those who are ages 5 to 7. An adult can fill that out, or if they're old enough, use your best judgment in order to determine the age, whether a parent should fill it out or whether the child is capable of filling it out for themselves. As most of our surveys begin, you will see the unique identifier that has been assigned to you as a community outreach worker. Every organization within the project has one identified as a unique identifier. It is a rather long number. Please write it down, have it on your phone, memorize it. You will be utilizing it and entering it in every time that you complete the survey. From there, we go into general information about the client. So things like their zip code, the date, so obviously today's date of the interaction that you have with the client, and is this your first time that you have been in contact with this client? From there, you will then go into just knowing where or what dose they're receiving at that date. Please ask this usually before you offer the survey, so that way you know which tool to pull up. However, at this stage in time is the best time for you to really identify that you're on the correct tool, for them being able to identify which manufacturer or brand they've received or are about to receive. From there, it kind of moves on to questions that the community member themselves can answer for themselves. However, you as a community health worker can assist them by asking these questions and entering in the answers that they tell you into the form. Just remember that there's a variety of reasons why a client may require assistance with this survey tool. It could be because they have difficulty with reading or literacy, difficulty with focus, they have their hands full. Just a general rule, please be compassionate and mindful when kind of asking these questions or clarifying the questions to help the client feel more at ease. The more comfortable the client is with the questions being asked, the more likely they are to complete the full survey. Know that if the community member is uncomfortable with at any time with any of the questions, it is acceptable and encouraged to allow them to refuse the answer and select the option of don't know, which many of these questions has that as an available option. And as a community health worker, in order for you to really be able to assist clients with this survey, please become familiar with the questions in order to help facilitate and keep the process flowing and really a comfortable space for the client. You can, in some ways, we do encourage that you do ask the questions as they're worded. Of course, some alterations may be needed if there's a lacking of understanding. We do encourage and really emphasize that you try to ask the question in a similar way to all of the clients as you're administering this tool at any given time. From there, this one is a specific tool to tool 3 for those in the primary series, which asks the questions of what may have caused a client to hesitate or delay in getting their COVID vaccine prior to this date. There is a variety of questions, of answers that they can give regarding to this. Please know that if you select none, it clears out all of the other answers and reasons. So if you do not intend to click that, save yourself the time of not clicking it unless you intend to click it. It's really key in this question, especially, that we do not, we allow ourselves the time and the space to not add any judgment or any sort of tone, and keep it very neutral and positive and light interaction. We do not want the client to get defensive about why they have elected to wait for their vaccine. And again, if they choose not to answer, it is perfectly acceptable to select none and move on from there. After this, we have identifying factors such as gender. Please know that, of course, this can sometimes cause clients to kind of pause and be like, well, don't you know? But of course, we cannot assume. We must have the client answer these, and we can say that it's sorry that this may seem obvious to us. However, it is a question that we would need to answer. And of course, we could always prefer not to answer or enter in anything else. Questions kind of continue there for demographics. Tools 3 and 4 are very similar with regards to things like ethnicity, race, languages spoken, and then at the very end, the question it can be worded differently based on whether you're on tool 3 or tool 4, but the answers remain the same. Essentially, you're wanting to know what resources helped prompt them to get vaccinated that day. The list is rather extensive. You can select more than one, and again, if none of these are really and capture what the client is hoping for, there is the ability to write in a response. And finally, just a general reminder again that tools 3 and tool 4 look very similar, but again, they are different tools meant to be used at different times. Tool 3 is meant to be utilized for anybody who's in the primary series, and you will see those. They will list different vaccines, obviously, because they will say boosters when it's boosters, which is on tool 4, or they'll say first or second doses when it comes to different manufacturers in tool 3. And of course, the question on vaccine hesitancy is not included in tool 4, just the demographics and where they learned about the event and who and what resources assisted them in getting vaccinated in this time. So those are the tools you'll be using for data collection within this project. Thank you for joining me for this mini session today.